sounds very quiet, just here, and then so the microphone's here, so you might want to raise it on just a little bit.
All right, good afternoon, everyone. Thank you for joining today on our Facebook Live event. My name is Kaylie Zaleski. I am a registered dental hygienist here, and this is Dr. Sauber. She is a family physician here at our residency department. So we're going to talk throughout our presentation today about how dental care can affect your overall health and tobacco cessation. First, I'd like to start off and remind everyone our hours and services we provide in dental. So our dental department in Battle Creek, we are open Monday through Thursday, 7:30 a.m. to 6:30 p.m. And then Fridays, we are open from 8 a.m. to 5 p.m. Our Albion location is open Monday through Friday from 8 a.m. to 5 p.m. We provide a variety of services, a lot of preventative services like cleanings, exams, sealants, fluoride application, and then also we do fillings, extractions. We can make some partials and full dentures, and some crowns and root canals. Dr. Sauber, can you share some information about the residency department?
Yeah, of course. I'm part of the residency department program here at Grace Health, and we are open Monday to Friday, and the hours is 8 a.m. to 5 p.m. Monday to Friday. And we are offering variety of services like prenatal care, well child visit, annual physical exams. We are also taking care of the chronic diseases like diabetes, hypertension, COPD. We also offer a chronic care complex to our patient as well. And we do lots of preventive care, and this month we are focusing on smoking cessation, as September is smoking cessation month.
That's awesome. All right, so first I am going to get started on how your overall health so your dental care contributes to your overall health. So your mouth is the gateway to the rest of your body. So how you care for your teeth and your gums directly affects other areas. With a healthy immune system, your body can naturally get rid of bacteria that's in your mouth. Your saliva helps rinse away bacteria, and brushing and having good oral hygiene. So if you have poor oral hygiene, or if you don't have enough saliva to help naturally rinse off that bacteria can grow, and it can go throughout the rest of the body and kind of cause an immune response and inflammation. So with poor oral hygiene, it actually increases your risk of heart disease by 70%, which is possibly due to the inflammation caused by gum disease. Anyone with diabetes and untreated gum disease actually has higher blood sugars, so it's very important for patients with diabetes to get regular checkups and get the deep cleanings that they need so that their gums can heal, and it can in turn lower your blood sugar. Osteoporosis also increases your risk of losing teeth. You have a higher risk of jaw fractures and things like that. Another thing, gum disease worsens blood pressure. It interferes with the medications that your provider has assisted with lowering your blood pressure. So that's very important to make sure you have good oral hygiene. Also, if you have some pulmonary diseases like COPD, it can actually aggravate the flare-ups, and you'll have more flare-ups. So it's just very important that you care for your mouth, you get all of your regular checkups, you get the treatment completed that's recommended. Gum disease is very prevalent, but it's treatable. Good oral hygiene and just talking with your doctor, your dentist about other conditions that you have, and we can give you some tips and tricks on how to have good oral hygiene and good dental care. So then you can in turn be healthy. Does anyone have any questions directly related to dental care and your overall health, or just any questions in general about dental? All right, so Dr. Sauber, can you kind of share, well, actually, Dr. Sauber and I are going to share about tobacco cessation. So, as you mentioned earlier, September, we are focusing on tobacco cessation, and we want to help provide you with tips and tricks and just information you may not know that we offer. So there are many different forms of tobacco. You have cigarettes, e-cigarettes, vaping, chewing tobacco, you have water pipes or hookahs. So lots of different varieties that people utilize to get that tobacco. And just so you guys are aware, cost-wise, smoking 1 pack of cigarettes a day, you'll spend over $3,749 a year. So if you smoke 2, of course, it's going to be double that. Using tobacco products does cause some risks in the mouth, so you have more staining of the teeth, you're at a higher risk of losing teeth, your gums receding, they pull away from the teeth, as well as gum disease is increased. Dr. Sauber, can you share how tobacco affects you?
Yeah, of course. Very good point. And also, like people who are smoking tobacco, they're gonna have the bad taste in the mouth, and the taste of the food gonna be not as good as other people who are not smoking. But overall, tobacco can affect the whole body system in different ways, and the most important one is the lung. People can get lung diseases. On top of that is COPD. It can exacerbate asthma. It can make people to go to the hospital and have lots of exacerbation of the COPD and asthma. And it increases the chance of lung cancer, and it's the most known carcinogen that can cause cancer. And also it increases the chance of cardiovascular disease like heart disease, stroke, and has effect on the blood pressure and makes it difficult to control other diseases. It decreases the immune system, makes people to get more infection, especially throughout the cold seasons like now. And but I would like to touch base about why it's more difficult to quit smoking, because tobacco, or better say nicotine, is an addictive drug, and it has a very strong effect on the brain, and it changes the brain in different ways, and that's why it's really hard to quit smoking. Nicotine starts a reward pathway in the brain, and by saying that, it makes lots of receptors in the body, especially in the brain. And by doing that, whenever you're smoking, that receptors are activated, and they always need to be fixed. And when you're smoking and you're fixing that receptors, the reward pathway gonna start working, and the dopamine will be released in your body, and that's the time that you're feeling good and you enjoy smoking. And the more you're smoking, it's going to be more receptors in the body, and they're asking for you to just smoke more and more, and that's the craving part. And that's why it's very difficult to quit smoking, because you're just feeding your body with nicotine, and it's asking for more nicotine, and that's why it's a vicious cycle, and it's very difficult to stop that. But the good news is that if you stop smoking at some point, this receptor is going to go down, and it's going to be less craving for smoking, but it's not going to be easy to do it on your own, and that's why there are lots of variety of resources that we can offer to you to go through this hard pathway. Okay, Kaylie, do you want to just talk a little bit about the tips and tricks that we can tell our patient to quit smoking?
Yes, of course. So Dr. Sauber shared some very good information. Nicotine, like she said, it's very addictive, and it's difficult to quit, but we're hoping some tips and support that we can offer to you today will help you in your journey to tobacco cessation. So first off, something that you can do is make a list. Make a list of all the reasons why you want to quit smoking for your own personal self. Set a quit date. Try to choose a time where you're not stressed. It's going to be easier to achieve if you don't have a lot of extra stress on your plate. I know it's kind of hard because we're always busy, but find a good time for yourself that works best for you. don't do it alone. Get support. You have support from your dentist, your physician, get support from family and friends or coworkers. Tell them that you're on this journey, you would like them to help support you through the process, that you can be successful. Also, you want to ask your dentist or physician if there's any products or aids that can help you with those cravings, to help you quit smoking. Find a healthy substitute to smoking. So, you have that correlation of bringing the cigarette or the vape to your mouth. So try to use sugarless gum, try to use hard candies that are sugar-free, sunflower seeds, carrot sticks. It looks like you can also go to thinking about the 4 Ds. It's called delay, drink water, do something else, and deep breathing. So delay. Remember, those cravings are only going to be 5 to 10 minutes. So delay. Drink water, so it gives you something to hold on to, and you bring it to your mouth, and you'll get more water that we could all use throughout the day. Also, do deep or do something else. So take that time that you normally would spend smoking a cigarette or vaping and go do something active. Go do something that you might not have time for. And then also deep breathing. Breathe in and out. Help relax yourself so you can get past that craving and move on with that next part of your day. It also looks like there is a question in the chat. So Dr. Sauber, looks like, to what extent can the receptors in the brain decrease when one stops using nicotine?
That's a very good question. Yeah, it's not very easy. It's not, when you stop smoking, it doesn't mean that all receptors gonna go down. Just imagine if there are like thousands of receptors on the brain and you're feeding them. By feeding them, they're gonna just grow more and more. But when you stop feeding them, the receptors number gonna go down. But it depends in people's chemistry. For some people, it happens like in a week. For other people, it takes longer. And that's the time that when people have the craving, because that's the time that the receptors are active. There isn't any specific time and date that I can tell you that, for example, after a week, it's going to be easy for you to stop smoking. And that's why that there are lots of aids available for people who cannot stop smoking on their own or quit smoking on their own. And that's really hard to say because people's body is different from each other, and it's not going to be the same for one person. For example, one person say, okay, I got cold turkey and I stopped smoking, and for other people it's not going to be this easy, and that's because the body chemistry is different in different people. But the receptor going to go down, and the speed is not going to be the same for everybody, and if it's not going to be easy for people to stop quit smoking, that's the time that you should just ask your doctor or pharmacist to offer you other aids that are available.
Do you mind sharing some of the aids and the products that are available for physicians to prescribe to help patients?
Yeah, of course, yeah. There are some scientifically proven ways that can help with the ease of quit smoking for those that are not easy for them to go through quit smoking. The one thing that's very popular is nicotine replacement therapy, or in short is NRT. Mm-hmm. We have 2 different of NRT treatment. One is the short acting, the other one is the long acting. The long acting one is the patches that slowly release the nicotine in the body, and it helps with the withdrawal symptoms for a longer time. The other one is the short-acting one, and we have a variety of short-acting nicotines like lozenges, gums, and sprays are available as well. And people have different preferences. Some like chewing gums, other like lozenges, and we always talk to our patient about that. And the good thing is that we can just combine these 2 short-acting and long-acting to each other to make it easier for them to quit smoking. For example, if you have the patches, it can slowly release the nicotine in a way that it's not gonna feel all of the receptors, but it's gonna feel them in a way that you don't crave smoking like quickly. But there are some moments in their life that people want that nicotine, and that's the time that we offer them to use the lozenges or the short-acting one like gums or sprays. And in that way, they can just get the nicotine but avoid all the harmful chemicals in the cigarette smoking.
Those are some great options to use to help aid quitting smoking. Thank you for sharing.
Yeah, of course. But there are medications available that I'm going to talk about it.
Yeah. What other medications?
Yeah, there are two medications available at this moment for quit smoking. One of them is a well-known medication that used to be used for mood disorders like seasonal affective disorder. Wellbutrin and Zyban is the brand name, but the generic name is bupropion. And this medication is available. Some people get a good result, and it usually needs to be taken at least for 3 to 4 months. And the doctor or the primary care should prescribe it for patient, and it should be close monitoring for medications, because all medications comes with side effect, and it's good to just have a primary care and ask them to just follow you and monitor the symptoms. The other medication, which is a newer one, it's Chantix, or the brand name is Chantix, and the generic name gonna be Varnis.
Again. So again, you can't get the bone you've lost back, but you can maintain what you have left, and then your blood vessels aren't constricting once you quit smoking, so you have easier healing in the mouth and your overall body.
Yeah, good point.
Another question is vaping any safer than cigarette smoking? No. So vaping is still new. Hospitals, doctors, dental professionals are still trying to do research and see the side effects for vaping.
That's true.
But the hardest part about vaping is there are so many different brands and products out there that are openly available to you, and none of it's regulated. It has a lot of different chemicals and flavors that nobody really knows what's in there. So vaping is not safer than cigarette smoking. It has its own risks, and especially in teens and young adults, starting to see more in the hospital. And I'm going to pass it over to Dr. Sauber because she probably knows some more cases about vaping and cigarette smoking.
Yeah, you said very well. Exactly, because it's not well regulated, and there are many chemicals in the vaping. When they just heat up, there are like some chemicals coming out from the vaping that are even more dangerous than smoking cigarettes. And there are some heart diseases that has been related to vaping, specifically vaping. One of them is popcorn lung disease, and it's usually happen in younger age people. And just imagine, vaping is something new. It just came out around 2003, and it hasn't been tested for a long time. And there are some diseases that we don't know exactly if it's related to vaping or not, but certainly it's not better than smoking.
I'm eager to still learn more about vaping, and I think awareness to the younger generation that it's still harmful. It might be easier to get, but it can have side effects on you long term, especially if you like sports. It's going to make breathing and becoming really good at those sports harder. Great question. I also want to point out chewing tobacco. I know back in the day, a lot of sports teams encourage chewing tobacco. So if you do utilize chew tobacco, it can cause different lumps and bumps in the mouth, especially if you keep that tobacco, that chew in the same spot day after day, time after time. In that area, your tissue will actually change and get whiter, and it will actually need to be biopsied to make sure that it didn't become cancerous. So even though you're not inhaling it, you're not swallowing it, it still gets into the bloodstream through the cheeks and under the tongue. So it's just as harmful as any other tobacco product that there is out there.
That's true.
looks like we have another question. Are children who smoke at a higher risk for damage since they are still developing?
Yeah, that's a very good question. We haven't talked about pregnancy and smoking. It's going to be so harmful, specifically for the fetus, because they are not going to have enough oxygen when they're growing, and it's going to be some damages to the babies, especially when they're in the womb. Like low birth weight, they can have some other sort of problem when they're just growing. They can be when they're like kids and the parents are smoking, they're going to be secondhand smoker, and they're going to be more prone to get asthma exacerbation, and also they can get more ear infection, and they can affect their cognitive development as well. And it's going to be like even more dangerous for kids because they are in a they're in a growing age, and it's going to be very harmful for their brain development. And they can develop lung diseases as well. They can have COPD disease without smoking themselves in a very young age. And there are a variety of issues that can be related to smoking for kids.
That's a great question. As well as for dental care, so patients that have gum disease and they're pregnant, there's lower birth weights. Pregnant patients that don't have good dental care also have gum disease, and you don't want any of the untreated cavities or gum disease, the bacteria, to go in other parts of the body. So it's actually very important to get dental care during pregnancy so that you can reduce the risk of infection and control any signs of gum disease that are present. All the different hormones in the body, your body might react to a little bit of bacteria or plaque than it didn't when you weren't pregnant. All right, everyone. I just want to thank you guys for joining us today. It was a pleasure talking about dental care and smoking cessation. If you have any other questions, don't be afraid to put them in, but I think we're going to end the session today. Thank you so much, and you guys have a wonderful rest of your day.
Thank you. Thank you, Kaylie.
Thank you, Dr. Sauber.